Welcome to Hashtag's Wednesdays Weekly, a weekly information session in collaboration with the voluntary sector and public sector partners. Our hosts for today is Nana and Kirit from Answer Cancer, and the session will be Raising Community Cancer Champions Part 1. Over to you both.
Hello and welcome to this morning's session. My name is Nana Opoku. I'm the engagement lead for Answer Cancer, and I'm here with my colleague Kirit. Kirit, can you please introduce yourself?
Thank you, Nana. I'm Kirit Patel. I'm the development worker that works alongside Nana, and I support Answer Cancer Champions in the work that they do in the region.
Okay, so in a couple of minutes we'll be starting. I'll just have to upload my PowerPoint presentation and then we'll get going. Okay, so this morning's session is all about peer support. We are going to talk about peer support in a different way than we already know. We are trying to find ways we can use peer support to connect people for better health. So let's get started. So the question is, what is peer support? Peer support refers to the various ways people use their own experience to help others having similar health conditions, to better understand what they may be going through and support them in their recovery journey. And so in peer support, people are brought together for a common good. People are given the space they need to actually be less formal so that everybody is at ease to share their own experience, ask questions, and receive the necessary support. Everybody's view is equally important when it gets to peer support, so no one is more of an expert than the other. Learning is also very practical and is based on lived experience. You may have noticed that I have some pictures on the screen here, and that tells you the difference that peer support makes. In the very first picture, we have a group of men sitting together talking about an issue that may be bothering them or an issue that is quite common to them. On the other end, we have a young boy with another one, and the one on the right seems to be shouting to the one on the left, telling him what to do. To be very fair, peer support does not go very well when you have to dominate the conversation. So to get on with what we are doing today, I would like you to keep the left-hand picture in mind. So we've already talked about the fact that peer support aims to bring people together. It aims to help people understand how to get along with each other, and it aims to also help people receive the kind of support that they actually need. So we are moving on to what about peer support, or why we think peer support is so important. A lot of research has been done into what people can do to help each other. And research indicates that people with common illnesses share their knowledge and experiences in a way that can easily reinforce positive behaviors, so that attitude and opinions or the way of doing things are better or are positively enforced in a more grander scale when people who share similar experiences share their experiences, and it has a much better influence than what most health workers can do. Peer supporters use their own experiences with diet, physical activity, and medicine adherence in helping people figure out how to manage their own health problems. Because it is quite frequent and it is ongoing, it is accessible in the community and is quite flexible, persons who receive support this way never feel isolated, even in their darkest moments of life. They are able to build in themselves resilience and the determination to succeed. When they learn from each other, they realize that they may not be experiencing things in isolation. They get to know local resources that are available for them. Example, where to buy healthy foods, where to get a convenient place to even exercise, where to get other amenities that are readily available, but they may not know of it. In cases that people of similar cultural and religious backgrounds and even people of social interests come together, the impact of peer support is even greater. So we know that peer support fosters understanding. We know that peer support enforces trust in the system that has already been put in place. We know that peer support actually helps people get over their health hurdles. And this is particularly important for the kind of work that we do. I would like you to focus on the picture we have on the screen now, and if possible, I would want you to unmute and just tell me what you see on the screen and what you think reflects the topic that we are sharing. So please unmute and just contribute at this point. Anybody?
Red jigsaw that's not fitting in place.
Okay. Anybody else?
Yes, it looks like the puzzle, like a missing jigsaw puzzle.
Okay. So thank you for your contribution. So what we have on the screen is what we find in real life. I want you to see the picture in two phases. The one on the left representing what you get if you have a family network, and the one on the right representing what you have when you are actually in a health setting. In most cases, when you are alone or you are in your darkest moments, you see these being apart. You don't see them together. And what peer support does is that red puzzle that fits in between. It tries to connect you with your family and also the health services. It connects the community with health services that you are receiving. So we want to see that red puzzle as the peer support that we can have in our communities. And it is a connection for people to gain good health. Okay, let's continue with the presentation. For those of us who work in cancer, we actually face a lot of negativity when we are working in the community. We know there's a lot of stigma, there's a lot of myth, there's a lot of shaming and blaming when it gets to cancer. In most communities, cancer is even a taboo, and we can't talk openly about it. We know that that is causing a lot of problems, and it is making the people who were initially experiencing a lot of disproportionate inequalities even worse. So people of BME backgrounds, people from the LGBTQ communities, people who have disabilities, people who have poor mental health, actually face a lot of stigma when they find themselves having cancer as well. And so what we do as Answer Cancer is to use what we have in the communities, that is the assets that we have in our communities, to actually change the negative perceptions that people have about cancer, and then replace it with positive things. So how do we do it? We want to make people feel that they have the right information. So what we do is to provide them with the right information. We help people to talk openly about their conditions, and we also try to signpost them to the right authorities or the right services that are found locally. Through that, we are able to give hope, we are able to help people survive their conditions, and we give them possibilities to look forward to. So back to peer supports. We know that there are many types of models that people use in community approach. However, there are three main models that we want to consider this morning. The first is the peer-led, second is coach-led, and the last is the professional-led. Let's start talking from the professional-led. With the professional-led model, we have patients who share similar conditions being brought together in a health setting, and a healthcare provider or a health worker leads a team to try to address their problems and help them manage their own challenges. So that is the professional-led. What about the coach-led? In the coach-led model, we have someone who may have experienced a condition very similar to what other people are experiencing, actually going further to have some form of training to become an expert, and so that you'll be able to listen, to discuss concerns, and also to provide support. And that is coach-led. The last type of model is the peer-led, which I want us to focus on this morning. And with the peer-led, we have people of similar backgrounds and of similar health conditions engaging with each other to enhance knowledge, to get mutual encouragement regarding how to self-manage their conditions. They use knowledge and experience that they have built over the years to educate others in their communities and their social circles. So how do they do it? In most cases with peer supports, you have either a group session or a one-to-one session. We know that COVID has come to change a lot of things in our communities, and the approach that we use is changing quite fast. And so the traditional face-to-face sessions are now being replaced by telephone conversations, are now being replaced by virtual or digital sessions, and that can be done using the web or email-based programs. You may be in a health sector, or you may be in a position to manage a community group. I think this is about time you share some experience that you have gained to discuss how you feel that peer support model can enhance your work. You can unmute yourself and contribute.
What was the question again, Nana? Sorry.
My question is trying to find out how you think that peer support can enhance the work we do in our communities relating to health.
Because the person that's experienced it is able to understand easily the people that join the group. They don't have to explain themselves too much, because it's hard enough anyway talking, but having to then further explain, it can you know, make you feel even more ill, withdrawn, maybe not come back to the group. So knowing that someone else understands really helps.
Good. I think that is a really good contribution. Any more?
Yeah, I really agree with Asma there. It's about that kind of like comfort in other people understanding maybe what you're going through, or being able to share your experiences to help others. And that in itself can kind of make somebody feel even better, you know, helping others and sharing their experience to support others as well.
And just to add, I think that what that brings us about the prejudice, the bias, what people experience, and that helps them back from actually sharing. And you don't have that judgmental experience and those sort of peer support areas, and so networks.
Good. So thank you very much for your contribution. We are going to see a video now to get a better understanding as to how some people in our communities are using peer support in the kind of work that they do. Please, let's listen.
How did you become a cancer champion then?
I wanted to promote and find out what prostate cancer is about, for one, but also just being able to help other guys like me who are in this situation.
So what have you been doing?
I've been out there talking to guys, street corners, pub, in the gym, you know, passing the word on. I don't go to church, but I know people at church, where I can find a group of guys and explain to them that, tell them, go and get a test, and give them support, advice, and don't be scared about, you know, going to get a blood test regarding prostate cancer.
What kind of guys have you been talking to then?
Well, I talk to anybody, all my friends, family, and it's such a brick wall asking the question about prostate cancer. My father had prostate cancer. I didn't find out until I had prostate cancer that my dad had prostate cancer. But when I asked the question to my dad, did he have prostate cancer? He denied it to me. And my father died knowing that he lied to me, and I couldn't understand why. And that's a massive wall that I'm trying to break down.
So do you always get a good response?
No. At first, it was absolutely, didn't want to listen, didn't want to know, very ignorant. And now, over time, a lot of people have actually gone full circle, come round, and guys have actually started to ring me up now, ask me questions and saying, you know, and I've been taking it. What? And I've really thought, oh my God, it's working. It does work, but it's taking time. A lot of guys have actually come back and asked me for advice, and I've pointed them in the right direction.
What do you get out of being a cancer champion?
I get satisfaction, I get pleasure, and I get pleasure knowing that if I know I've saved one person's life by guiding them in the right direction, I've done my job.
Okay, so thank you very much. I will now pass on the mantle to my colleague Kerrit to just highlight a bit more as to what we are doing with our project. As we rightly saw in the video, our project is all about cancer, and we are using these assets that we have in our communities, like we just saw in the video, to actually help people to understand why they need to talk about cancer a bit more in their communities. And we believe that even if one person can support other people, and then we'll get the levels of cancer down in Greater Manchester, and we'll get more people going for cancer screening. So I'll pass on the baton to Kerrit.
Thank you, Nana. So Answer Cancer, you might be asking, what is Answer Cancer? And Answer Cancer is a program led by a partnership of voluntary, community and social enterprise that's responding to cancer within the region. And the work is about encouraging people to take up screening, NHS screening programs, bowel, cervical and breast. These 3 national screening programs are targeted at particular groups and at particular ages. So our job is to encourage those communities in Greater Manchester who are not coming forward. And that's, as Nana said earlier, is all the groups which are neglected or who are not aware of what those screening programs exist, and the cancer awareness of themselves, about what it means and how to come forward. And so it's disabled people, it's people with poor mental health, it's BME communities, it's people on low incomes, people with poor mental health, and people living in deprived areas. So, and we're particularly targeting those areas of Greater Manchester, which is seeing kind of poorer performance, if you like, in terms of communities coming forward. So we're talking about Salford, Manchester, Bolton, Oldham and Rochdale. So our job is to engage with individuals and organizations to become cancer champions. Now, when we say, what does it mean to be a cancer champion? I think you just heard Gilbert there as describing very much about his own personal experience of being affected by prostate cancer, and then sharing that, in his own family and some of the barriers that he experienced, and then talking that within his community, and then seeing the response and seeing the network of people coming behind that. So within this model, you've got raise awareness, which is raising awareness as a first point, and then going out, and getting more training, because you can get, your own kind of understanding of it, but you need to make sure that as Nana said earlier, it's about the myths and the taboos, and we have to challenge some of those myths and those taboos within communities as well. So part of our work is to provide training to cancer champions and organizations so that they are fully conversant about knowing about the signs and symptoms, knowing about the NHS screening programs, and knowing about how they can get involved, how they can get engaged. And this kind of leads into the whole area of empowerment of community groups and in their community networks, because this is an asset-based community development approach. It's not a top-down approach. It's not a professional approach. It's led by the people from the perspective of grassroots communities, and they understand their own communities the best. They know what will work. They know what messages they will hear, and they will know what messages will work. And it's about what works. It's not about what doesn't work. It's about what works. And then that leads to this added value that, peer-to-peer to support, it adds value to all the professional work that's been done by practitioners and community organizations, because they're funded to provide some of these services and engagement. But actually what we know is that actually it's the people who actually take part as service users, as activists, as people who are in the community, to kind of take ownership of it. And from that, we've got this family of growing cancer champions. And currently we've organized and we've organized training for people to become cancer champions. We've supported them through training and information networks. We developed them in terms of bringing them together as a network of champions, as through drop-in sessions, a bit like this, like a Zoom sessions. And finally, this then hopefully leads to what our overall goal is, that we want to have cancer detected earlier, at an earlier stage. We want to improve cancer awareness and take up cancer screening programs, and so therefore, and save lives in the long run. That's our overall goal. And so, this is part of that movement. Nana, one more slide, I think. So just to kind of, this is the approach. It's an asset-based community development approach, recruiting champions, sharing information, training and support, and engaging in peer activities, learning and reflection, because that's the way that we know that helps people to improve on what they do as we go forward. So part 2, which is in 2 weeks' time, is more about this approach and about how we work as a partnership for organizations to respond to cancer in Greater Manchester.
Thank you very much, Kerrit, for your nice presentation. I think it's time for us to open the floor to anybody who has questions